This Saturday, April 15th meeting of Senate Finance Committee will come to order. We have, counting those, including those remote members, we have a quorum present. And we have one bill on the agenda, Senate File 2934, Senator Hoffman's Omnibus Human Services Budget Bill. Senator Hoffman, welcome to the Finance Committee.
Mr. Chair, thank you. Thank you, Mr. Chair and members, for hearing Senate File 2934 today. I do want to go over a few spending provisions in our bill. As you know, the Omnibus Finance Bill for the Human Services Committee, it's more than just a spreadsheet, Mr. Chair, and I want to highlight at the end some of the key expenditures in our bill, but explain those interactions with the rest of our lives. And so, Mr. Chair, if you'd like to, we'll go to the A28 amendment. If somebody would offer that, I'd appreciate that.
Senator Murphy offers the A28 amendment. And Senator Hoffman, this is just, Kyle, want to just briefly explain the nature of this one?
Mr. Chair and members, Liam Monahan is here to do this. This is the big amendment that everybody was, running around the Capitol last night talking about. So, Mr. Monahan.
It's thick, not that thick. Mr. Monahan, welcome to the committee, and please go ahead with it.
Mr. Chair, members, I'm going to briefly go through the A28. I'm going to point out the substantive changes or changes that might appear to be substantive even though they're technical. Most of the amendment is technical, and I'm going to skip over those portions of the amendment. So on page 1, line 3, it's deleting a section related to the Office of the Ombudsman for Mental Health and Developmental Disabilities related to their administrative funding. It was determined that this section wasn't necessary. On line 4, it appears that we are deleting a section related to a public awareness campaign to be administered by deed. It's not actually being deleted, it's being moved. The language is recreated at the bottom of page 1, beginning at line 21. The next item I'll point out is on line 13. We're deleting section 58. This is related to the HCBS services study. We're not actually deleting the language, we're moving it to the appropriations article. On lines 14 and 15, it appears that we are moving some money around between fiscal years. Staff decided that perhaps a different approach was better. I think this topic is going to be discussed later when Mr. Raymond goes through the spreadsheet. The next major change is on page 3. Beginning at line 4, we've included, or Senator Hoffman has included, a small appropriation to Anoka County to administer costs related to fielding and responding to violations of the rent control provision that's currently in the bill. Page 3, beginning at line 8, are some technical changes. TA from the Department of Human Services related to non-emergency medical transportation, modifying effective dates, and including a provision related to managed care that was inadvertently omitted from the bill in earlier versions. On page 4, line 14, we're deleting section 1. This was the correction of a drafting error from a few years ago, but this language was included in the reviser's bill that was passed off both floors earlier this week, and so is no longer necessary. On line 15 of page 4, we're deleting section 3. This is deleting an orphan provision from a governor's proposal that actually was not included ever in the bill, but inadvertently was included. It was a conforming change to the proposal, not the proposal itself. Beginning at line 18, this appears like it's new language. It is not. It is codifying a grant that's already in the bill but appears later in the bill as an uncodified section. Beginning on line 24 of page 4 are a number of technical and conforming changes related to appropriations from revenue that is received from the opioid licensing and registration fees. This is related to a governor's proposal to provide ongoing funding from years ago that was temporary. On page 5, line 10, this is deleting the uncodified section related to a grant program that was recreated earlier in the amendment on the prior page. And finally, on page 5, line 13, Senator Hoffman has decided to remove an amendment that was put on in the Human Services Committee related to the county share for civilly committed individuals at AMRTC. And so this reverts the bill to the language as it appeared in his DE in Human Services. The rest of the amendment is a deletion and reinsertion of the appropriations article. The technical changes that were made to the article were so significant that it was difficult to process the amendment without simply deleting it and reinserting it. I think we're going to go through that at a later stage in today's presentation.
Thank you. Is there any discussion of the 828 amendment to put the bill into shape the author has and in the targets and everything else? Is there any discussion? If not, all those in favor say aye.
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 Opposed?
Aye.
Opposed? Motion prevails. Senator Hoffman, did you want to have Mr. Raymond go through the...
Thank you, Mr. Chair and members. If I could, I wanted to just briefly highlight just 10 key spending provisions, just so you have a narrative, and then to have Mr. Raymond and Mr. Monahan then take us through the scale of the bill. And I just want to let you know, Mr. Chair, that I did work to get within the target that was given, and I will address that later in my comments. But I just wanted to make sure that you and the other members were aware that we did what we were asked to do by Senator Dietzick and you. And so there are 10 key spending provisions. One, we look at a full phase-in of the elderly waiver homemaker rates and inflationary adjustment. And you'll see that, members and Mr. Chair, that's $28 million in 24-25 and 49.5 and 26-27. What that really does, Mr. Chair, and as you'll note in my comments later on, there's an interaction of services within our groups that extends and updates elderly waiver rate framework to disability homemaker services, and fully phased it in, Mr. Chair. And also, we updated the base wages to data most recently available in the Bureau of Labor Statistics wage code data in January 2024 and every 2 years thereafter. That results in basically a rate increase for disability waiver homemaker services in that first phase. We tried to make it real. The second one, let me point out, is the intermediate care facilities DD rate increase and rate floor. Mr. Raymond will go through those, the dollar amounts, but what we did there, Mr. Chair, was we increased rates for the intermediate care facilities for persons with developmental disabilities by $50 for Class A facilities and $50 for Class B facilities. The proposed minimum rate for Class A facilities is $300 and Class B is $400. That requires 80% of rate increase to be spent we put this in there, Mr. Chair, and it's something that we really do well, is 80% of the rate increase should be spent on wages of that employee-related costs, right? The third thing is the disability waiver rate services framework modification. We made changes to automatic adjustments to the disability rate service system, DWRS rate methodologies. The proposal updates the competitive workforce factor on January 1 of 2024 and every 2 years, and those are based on the Bureau of Labor Statistics standard occupational classification codes. And we have no limit on the increase, though. It may not decrease by more than 2 percentage points. So we try to take care of that competitive workforce factor in there. Current law right now has a competitive workforce factor of 4.7%, adjusting that to 16% as of January, which really results in a weighted increase of 6.11% across all DWRS services. The fourth is the Community First Services and Supports Rate Framework and Modification. That is the governor's proposal, Mr. Chair, that we invest in rate increases, retention bonuses, and paid time off for PCA CFSS workers. And we develop a career ladder with corresponding tiered rates so that workers can advance in their careers and be more willing to join and stay in the workforce. We have, as you know, in the caregivers, we put them all into one big bucket. There's 53,000 job openings in the caregivers field. We provide necessary funds to cover the expenses arising from labor disputes. We also provided funding for provider training stipends and provider orientation, which was a gap. The fifth, Mr. Chair, is the home and community-based services providers, elderly waiver, ECS rate increases, and the CDCS, lots of acronyms, isn't it? Increases. That's the governor's proposal. That gets the elderly waiver, alternative care, and the essential community supports programs for people in the HCBS, 65 and older, on Medicaid who require a level of care provided in nursing homes. And then key that, they provided in care, but choose to live in the community. Shouldn't that be something that we attain for as far as a goal goes? The community-directed community supports, consumer-directed community supports option under elderly waiver is a critical model to help address the workforce shortage. Through CDCS, participants can use their monthly budgets to hire their own workers as they see fit to provide the services and supports unique to their individualized needs. That proposal adds a requirement that directs 80% of any increased revenue toward compensation-related employee costs. Number 6, Mr. Chair, is the customized living for brain injury and community alternatives for disabled individuals adjustment that also recruits the 21.6% new rate methods, right? We increased those rates for customized living services paid through those waivers, and we align them with the elderly waiver customized living rate components. This change will result or increase disability waiver customized living rates by 5%. Number 7, there's a rate increase for home care services. Those we look at increasing payment rates for home health aides, home health services, home care nursing services. And number 8, we a big piece that has been bothersome for many years, and Senator May Quaid brought this, is the medical assistance employed people with disabilities, premium modifications, and asset limit elimination. Here are people that want to work full-time, can work full-time, but the system, Senator Marty, the system fails to support that process that they want to work in. And so what we do is we eliminate the $20,000 asset limitation, and we establish a citing fee scale for premiums that are based on the gross earned income. We streamline the medical assistance program for employed persons with disabilities by changing the income review from 6 months to yearly. Number 9, we put in a line there that nursing facilities rate increase. And Mr. Chair, I'll tell you, you know, you talk about the value-based reimbursement system. Yep, you're right. But then at the same time, when we look at nursing homes P&L, they're also right. There's still a gap that exists. We need to address that gap. This is one way of starting to do that, and there's been lots of conversation on that. And you need to know Elise Bailey from the Department of Human Services has been absolutely a wonderful partner in this whole process, and we look forward to continuing working with the department going forward. And finally, the number 10 one I wanted to highlight was we want people at home, so we're really establishing a Live Well at Home grants, and we had put in there pieces that support older Minnesotans' desire to live at home through the home and community-based service supports. That's home modification, caregiving, transportation, and home delivery. And we do some additional funding for basic operating costs, and those are grantees that have continuous service and needs within that existing program. I just wanted to highlight those, Mr. Chair's 10 key spending provisions that we tried to keep the theme based upon what the needs are and tried to get the rates established so we can start to address that 53,000 members that are openings that are there and give people a wage. And you'd be interesting. I shared with you and Mr. Nauman a spreadsheet that the department gave us about rates, and it was the first time you had seen something like that, and it was an eye-opener for you. Right. So now you know why we have the problems, what we do, and why our committee really was a nonpartisan committee, Senator Marty. It really was, everybody had a role in the committee, and we got to the reasons on why. So with that, I want to turn over to Mr. Raymond, Kyle Raymond, who's going to take you through this 300-page spreadsheet.
Thank you, Senator Hoffman and Mr. Raymond. Please go ahead with the spreadsheet.
It's only 21 pages. I'm sorry. I just wanted to see if you would laugh. That's all.
Thank you, Mr. Chair. Members, good afternoon. Kyle Raymond, Fiscal Analyst of the Human Services Committee. So as Senator Hoffman mentioned, I'll be walking through the spreadsheet today. So just first to kind of orient members on the spreadsheet. First off, for members as well as members of the public, the spreadsheet I'm working off of in referencing page and line numbers is from April 13th at 11:41 p.m. So to provide an overview of the spreadsheet, the first page includes summary information, and the remainder of the document includes detailed information about the specific proposals included in the bill. And then there's essentially 3 sets of columns on the spreadsheet. The left-hand side includes descriptive information. The center set of columns includes the governor's revised budget recommendations. And then the right-hand set of columns includes Senate File 2934. And I'll note that this is as reflected in the 828 amendment that was just adopted. Just at the time the spreadsheet was published, I did not have the specific amendment number available. So to begin on lines 5 through 7, this includes the general fund appropriations for all agencies under Human Services under the committee. Looking to line 6, that includes the general fund February 23 forecast numbers. The fiscal year 24-25 total is just over $12.7 billion, and then the 26-27 total is just over $14 billion. Line 7 includes the general fund net increases from the bill. However, I'll touch on those specific figures in a moment. And then on line 8, that is just the combined total for the two. So now moving to the second set of rows, this includes the total, the net fiscal impact for all Human Services bill agencies. Looking to line 13, this includes the general fund total. And as Senator Hoffman mentioned, the bill meets the target of $1.3 billion in the 24-25 biennium, which is the combined total on lines 13 of the 23, 24, and 25 totals. And then also on line 13 is the $1.55 billion total for the 26-27 biennium. The next few rows are just the different totals for other funds, if members are interested. Moving now to lines 41 through 48, this shows the medical assistance breakdown by eligible category with the cumulative total on page 48, or excuse me, line 48. And then lines 51 through 96 include the agencies that are funded in the bill, broken down by fund, if members are interested. So moving now to page 2, I have a couple of notes before going into the proposals. So first, there's a little over 100 proposals to walk through that are included in the bill, so in general, I'll keep my remarks brief, except for proposals that may be of interest, but if there are any questions, either myself or Mr. Monahan can attempt to answer those. In addition, if there is either a pound sign or a hashtag included for this is a proposal that doesn't have a cost but has some sort of budget impact. And then the last note is if there is no amount included for the proposal in the right-hand set of columns, then that means the governor's proposal was not taken, and I'll plan to just skip over those as I go through my comments. So now, beginning with the first proposal on line 122, this proposal establishes a long-term care access fund. So this proposal establishes the fund and then defines a contribution amount, which is the medical assistance long-term care spending, the difference between the most recently enacted appropriation and the November forecast. If there's a positive budgetary balance, then the fund would be, the long-term care access fund would be funded to the contribution amount. Moving on to line 125, there's a proposal that returns forecasted funds to nursing facilities. So this is includes a provision that allocates the difference between forecasted nursing facility spending and actual nursing facility payments. The difference between those two, if positive, would then be allocated to nursing facilities as an add-on. So for these first two proposals, the future value of the allocations are unknown just due to the uncertainty of the future forecasted amounts. So moving on now to line 128, this is the governor's proposal, and this proposal, excuse me one moment.
Senator Draheim, if you're able to mute your microphone, it'd be helpful. Thank you. Please continue, Mr. Raymond.
Thank you. So on line 128, this is a governor's proposal that provides funding for systems costs in order to transition nursing home payment rates to a new state case mixed system. So this is related to changes made at the federal government. The funding for this proposal included in the bill is $117,000 in the 24-25 biennium and $70,000 in the tails. Moving next to line 137, this is a governor's proposal related to tribal EIDBI reimbursement rate increases. So this would be funded at $27,000 in the 24-25 biennium and $46,000 in the tails. Moving to the next proposal on line 153, this is a governor's proposal that increases positive support services rates. So this proposal is funded at $891,000 in the 24-25 biennium and just over $2.1 million in the tails. So next, moving to page 3, the next proposal included in the bill is on line 166. This is a proposal from Senate File 7, and I'll note here that the amendment numbers are included as a reference to the fiscal notes. The fiscal notes were requested based on, I think they were broken up into about 22 different amendments. So if members or members of the public are interested in looking at the specific fiscal notes, I included that in order to identify those. So to the proposal on line 166, this is a full phase-in of elderly waiver homemaker rates as well as an inflationary adjustment. This proposal has a fiscal effect of $28.551 million in the 24-25 biennium and just over $49.9 million in the tails. Moving next to line 170, this is both a governor's proposal and a proposal that was included in Senate File 7, and this increases the paid hours limit for parents and spouses of CFSS and CDCS, and this is funded at just over $4 million in the 24-25 biennium and just over $7.37 million in the tails. So moving next to line 176, this is a governor's proposal that modifies labor market reporting to include direct service professionals. This proposal, the fiscal effect of it that's funded in the bill is $687,000 in the 24-25 biennium and $654,000 in the tails. So moving to the next proposal on line 182, this is a governor's proposal that increases Direct Support Connect and Disability Hub access. This proposal is funded at just under $1.2 million in the 24-25 biennium, and in the tails is just over $1.3 million. Moving next to line 190, this governor's proposal is included in the bill that provides additional funding for the HCBS Innovation Pool. This proposal includes funding for just over $4.3 million in the 24-25 biennium and just over $4.4 million in the tails. Moving next to page 4, line 201. This is a provision from Senate File 7. This proposal directs the Department of Human Services to provide recommendations for establishing a life-sharing services benefit, and this is a one-time expense of $90,000 in the 24-25 biennium. Moving next to line 211, this is a proposal from Senate File 7 that Senator Hoffman already mentioned related to ICF and DD rate increases, as well as it also implements a rate floor. And that fiscal effect of this proposal is just over $25 million in the 24-25 biennium, and also just over $25 million in the tails. Moving to the next proposal on line 222, this is a proposal from Senate File 7 that modifies a disability waiver rate system framework. I believe Senator Hoffman also mentioned this in his opening remarks. This proposal is funded at $111.396 million in the first biennium, and then about just over $279 million in the 26-27 biennium. Moving next to line 227, this is a proposal from Senate File 7 that would allow respite services to be paid at market rate. The fiscal impact of this proposal that is included in the bill is $109,000 in the 24-25 biennium and $36,000 in the tails. Moving to the next proposal on line 231, this is another proposal from Senate File 7 that makes modifications to the Employment Exploration Wage Index. The fiscal effect of this would be $228,000 in the first biennium and $448,000 in the tails. Moving now to page 5. The next proposal included in Senate File 2934 is on line 236. It's a proposal from Senate File 7, which makes modifications to shared services and results in a fiscal impact of about $417,000 in the first biennium and $43,000 in the 26-27 biennium. Moving next to line 245, this is a governor's proposal included in the bill that Senator Hoffman previously mentioned, the Community First Services and Supports Rate Framework modifications and funds the SEIU bargaining agreement. This proposal includes the full funding from the governor's budget of just over $297 million in the 24-25 biennium and just over $478 million in the 26-27 biennium. Moving to the next proposal on line 255, this is a proposal from Senate File 1597 related to PCA driving personal needs eligibility, and the fiscal impact of this proposal that's funded in the bill is $1.688 million in the 24-25 biennium. The next proposal is on line 261. This is a governor's proposal that provides rate increases for home and community-based service providers, as well as the CDCS budget increases their budget. So this proposal is funded at $40.397 million in the 24-25 biennium and just over $96.6 million in the tails. The one thing I'll note for this proposal is there's a one portion on line 269 related to increases for customized living that is not included. It was included in the governor's proposal, not included in Senate File 2934, and that's because there's a subsequent increase for customized living included in a separate proposal in the bill. So moving now to page 6, the next proposal included is on line 275. This is a proposal from Senate File 7 that establishes an elderly waiver rate floor for disproportionate share facilities. The fiscal impact of this proposal is just over $10 million in the 24-25 biennium and just over $15.8 million in the tails. Moving next to line 280, this is a governor's proposal related to critical access nursing facilities. This proposal is has a fiscal impact included in the bill of just over $1.9 million in the 24-25 biennium and $2 million in the 26-27 biennium. So moving next to line 284, this is a governor's proposal related to the Vulnerable Adult Act redesign. So this proposal is funded in the bill at a total of $53.744 million in the 24-25 biennium. And for this proposal and a few subsequent proposals, I just wanted to note that these funds, as written in the appropriations article, both the grant totals and the administrative costs would be available until through fiscal year 2027. So the funds, as you can see, compared to the governor's budget, the funds in the tails were made available up front, and then the funds would be available through 2027. However, the grants would not be ongoing. And I'll try to note those. There's a handful of more instances where this occurs, and I'll note those where applicable. So moving next to line 293, this is a governor's proposal that provides long-term care workforce grants for new Americans. So this is another example of the funds being available until 2027. So the funding for this proposal is 20.24, just over 21.2 million, excuse me, in the 24-25 biennium. And these funds would be available through 2027. Moving next to line 300, this is a governor's proposal that provides ongoing funding for the provider capacity grants for rural and underserved communities. So this is again an example of grants that would be funded at just over $15 million in the 24-25 biennium, and both the grant and administrative funding would be available through 2027. Moving to the next proposal on line 307, there's a governor's proposal related to providing additional funding for research and access to long-term care services and financing. I believe this is also referred to as the long-term care actuarial study. So this proposal is funded at $476,000 in the 24-25 biennium. So moving to the next proposal that's included in the bill on page 7, line 326. This is a governor's proposal that provides funds a study for waiver service accessibility. This is funded at $548,000 in the 24-25 biennium. So moving to the next proposal on line 332, this is a governor's proposal related to providing home and community-based services curriculum and training plans. This proposal is funded at just over $1.3 million in the 24-25 biennium and $416,000 in the tails. The next proposal included in the bill is on line 338. This is a governor's proposal related to technology for home grants. This proposal is funded at $757,000 in the 24-25 biennium and $810,000 in the tails. Next, on line 344, there's a governor's proposal related to that establishes temporary grants for customized living providers. This proposal is funded at $1.79 million in the first biennium and $208,000 in the 26-27 biennium. Next, moving to line 351, this is a proposal from Senate File 7 related to BI and CADI customized living rate increases. This again was a proposal that Senator Hoffman mentioned during his opening comments. So this proposal is funded at, it has a fiscal effect that's included in the bill of just over $13.9 million in the 24-25 biennium and $33.1 million in the 26-27 biennium. The next proposal included in the bill is on line 355. This is a governor's proposal that establishes assisted living facility closure payments, and it has a fiscal impact included in the bill of $944,000 in the 24-25 biennium and just over $1.8 billion in the tails. So moving next to page 8, the next proposal included in the bill is on line 387. So this relates to special minimum wage clarification under a 14C certification. So as previously mentioned, this is marked by, doesn't have a fiscal cost and is marked by the pound signs. So moving next to line 359, a governor's proposal that expands the MinChoice's operational budget. This is funded, the fiscal effect of this that's funded in the bill is at $3.7 million in the 24-25 biennium and just over $4 million in the tails. So moving next to page 9, line 407, is the governor's proposal related to addressing the HIV epidemic in Minnesota. So this provides a one-time grant in fiscal year 2024 of just over $10 million. The next proposal is on line 433. This is the governor's proposal related to improving quality of substance use disorder treatment and also addressing some administrative burdens. The proposal is funded at just over $2.2 million in the 24-25 biennium and just over $2.4 in the 26-27 biennium. So moving next to line 453, this is a governor's proposal related to ongoing funding for the traditional healing grant. So as indicated in the description, this is an fiscal impact to the opioid epidemic response fund, and there's a total of $2 million in the 24-25 biennium and is ongoing. The next proposal is on line 457. This is a governor's proposal that provides ongoing funding for the overdose prevention grant. This is also a fiscal effect to the opiate epidemic response fund and is funded at $100,000 per year ongoing starting in fiscal year 2025. Moving next to line 461, this is a governor's proposal that corrects a technical drafting error that prevented grant funds from being expended. In the governor's budget, there was the administrative funds added to disperse those funds, so those are not included in Senate File 2934. However, the drafting error is corrected. So moving next to line 467, this is a governor's proposal related to providing competency-based training for substance use disorder provider community, and this proposal is funded at $606,000 in the first biennium and $136,000 in the 26-27 biennium. Moving next to line 473, this is a governor's proposal related to providing family treatment startup and capacity building grants. So this proposal is funded at $10.6 million in the first biennium and $640,000 in the tails. And I'll note with this one that there's a $10 million grant included in the proposal in the governor's budget, which had the funds are available until through fiscal year 2029. So moving next to page 11, the next proposal included is on line 481, a governor's proposal related to requiring naloxone on site for substance use disorder treatment facilities as well as certain public entities. And it also includes naloxone training grants. So this proposal is has a fiscal impact included in the bill of just over $3.2 million and in the first biennium and $3.3 million in the tails. Moving next to line 486, this is the governor's proposal that establishes a public awareness campaign for substance use disorders. So this proposal is funded at $600,000 in the first biennium and is ongoing. Moving next to line 490, this is a governor's proposal that establishes an overdose surge text alert system. So this proposal is funded at $359,000 in the 24-25 biennium and $372,000 in the 26-27 biennium. So moving next to line 505, this is a governor's proposal related to harm reduction and culturally specific grants. So this proposal is funded at just under $1.2 million in the 24-25 biennium and just over $1.2 million in the 26-27 biennium. So moving next to line 511, this is a governor's proposal related to providing technical assistance for culturally specific organizations. This is funded at just over $5 million in the 24-25 biennium, and this is another example of the funds being available both for grants and admin through fiscal year 2027. So moving next to page 12. The next proposal included is on line 518. This is a governor's proposal that provides ongoing funding for recovery community organization grants. So this proposal is funded at $6 million in 24-25, and the grant funds would be available through fiscal year 2027. Moving next to line 527, this is a governor's proposal that provides additional funding for training the peer workforce. So this proposal is funded at $4.25 million, and this would be one-time funds. Moving next to line 532, the governor's proposal that provides grants to culturally specific recover community organizations for startup grants. So these grants would be funded at just over $4.4 million in the first biennium, and would be one-time grants, but that would be available, both the grants and the admin, through fiscal year 2027. So moving next to line 543, this is a proposal from Senate File 2490, which establishes relates to eligibility modification for recovery community organizations. So the proposal is funded at $299,000 in the 24-25 biennium and $408,000 in the 26-27 biennium. Moving next to line 548, this is a governor's proposal that includes counties as eligible vendors of medical assistance peer services. So this proposal is funded at $170,000 in the 24-25 biennium and $270,000 in the tails. Moving to page 13, the next proposal included, the next two relate to Project ECHO, but are different proposals. The next proposal included is on line 559. It's a governor's proposal that expands Project ECHO and establishes an opioid treatment program-led practitioner hub. So it would establish a practitioner hub that is led by opioid treatment program. And this proposal is funded in the 24-25 biennium at $536,000, and then in the tails is funded at $800,000. Moving next to line 566, this is a proposal from Senate File 2486 related to Project ECHO, establishing Project ECHO at Hennepin Healthcare. This proposal would be funded at $2.9 million in the 24-25 biennium and $3.2 million in the 26-27 biennium. The next proposal included is on line 572. It's a governor's proposal that makes modifications to opioid treatment rate methodology. The proposal results in a fiscal impact of $746,000 in the 24-25 biennium and just over $700,000 in the 26-27 biennium. Moving next to line 582, so this is a governor's proposal that funds a medical assistance demonstration waiver study. The fiscal effect of this proposal is $616,000 in the 24-25 biennium and $224,000 in the tails. Moving to the next proposal on line 588, this is a governor's proposal that provides startup and capacity building grants for withdrawal management. This proposal is funded at $3.932 million in the 24-25 biennium, and both the grant and the administrative funds would be available through fiscal year 2027. So moving next to page 14, line 601, this is a governor's proposal that makes modifications to the direct care and treatment program. So this proposal has a net fiscal effect of 0. However, there are a couple of enterprise funds that are being brought into the general fund, and then essentially the net fiscal effect results in 0. So moving next to line 614, this is a governor's proposal that maintains current service levels for direct care and treatment. The fiscal effect of this proposal is just over $99.6 million in the 24-25 biennium and just over $116.8 million in the tails. Moving next to line 623, it's the governor's proposal that establishes a direct care and treatment electronic health record system. So this proposal, the fiscal effect of it is $20.9 million in the 24-25 biennium and just over $22.2 million in the 26-27 biennium. Next, on line 629, this proposal is a governor's proposal that addresses a direct care and treatment fiscal year 2023 operating deficiency and has a fiscal impact of just over $4.8 million in fiscal year 2023. So next, moving to line 633, this is a governor's proposal that makes modifications to the MAEPD program. So this proposal is funded at $250,000 in the 24-25 biennium and $84,000 in the 26-27 biennium. So moving now to page 15, the next proposal included in the bill is on line 642. So this repeals the opioid prescribing improvement program. I'll note here the proposal above is a governor's proposal related to this topic, so that was not taken. This was undone in an amendment in the Human Services Committee. However, the proposal also repealed some existing statute or repealed the opioid prescribing improvement program statutes, and it results in a net fiscal effect of a savings of $89,000 in the 24-25 biennium and then a savings of $172,000 in the tails. Moving next to line 656, this is a proposal from Senate File 7, which results in a non-emergency medical transportation rate increase. So this proposal has a fiscal effect of just over $10.6 million in the 24-25 biennium and just over $15.7 million fiscal effect in the 26-27 biennium. Moving next to line 662, this is a proposal also from Senate File 7 that creates fuel adjustments for non-emergency medical transportation and ambulance services. So the fiscal effect of this proposal is just under $2 million in the 24-25 biennium and just over $1.7 million in the 26-27 biennium. Moving to the next proposal included in the bill on line 672. This is a governor's proposal related to improving the MA experience for people with disabilities. The fiscal effect of this proposal is just over $8.5 million in the 24-25 biennium and just over $5.9 million in the tails. So moving now to page 16, the next proposal that's included in the bill is on line 678. This is both a governor's proposal as well as was included in Senate File 2616. This is a medical assistance enteral feeding product rate methodology change. The fiscal effect of this proposal is just over $3.3 million in the 24-25 biennium and just over $5.1 million in the 26-27 biennium. The next proposal included in the bill is on line 686. This was a proposal included in the governor's revised budget as well as in Senate File 2796 that provides funding for the Office of Ombudsperson for long-term care staffing. This proposal is funded above the governor's funding included in the revised budget and is a total of just under $3.8 million in the 24-25 biennium and just over $4 million in the tails. Moving next to line 690, this modifies the medical assistance income and spend down limit. This proposal is funded at exactly at $5 million in the 24-25 biennium and is ongoing. Moving next to line 694, this is from a proposal from Senate File 758 that modifies community residential setting licensure requirements. The fiscal effect of this proposal is $315,000 in the 24-25 biennium and $330,000 in the tails. Moving to line 701, this is a proposal from Senate File 759 that establishes a hospice respite and end-of-life care MA benefit for individuals that are under 22 years old. The fiscal effect of this proposal is $159,000 in the 24-25 biennium and $190,000 in the 26-27 biennium. Moving next to line 706, this is a proposal from Senate File 902 that increases rates for home care services. The fiscal effect of this proposal is just under $64.3 million in the 24-25 biennium, and about $99.56 million in the tails. Moving next to line 713, this is a proposal from Senate File 993 that establishes a HCBS Workforce Incentive Fund grant. This proposal is funded at $42.13 million in the 24-25 biennium and roughly $6.37 million in the tails. And I'll note there is a separate proposal later on for another fiscal effect for this proposal for another agency that I'll touch on later. So moving now to page 17, line 720. This is a proposal from Senate File 1020, which modifies the Essentials Community Supports Program and provides ongoing funding for respite service grants. So this proposal is funded at $6.8 million in the 24-25 biennium and $32,000 ongoing. So with this, there's a grant component to the program, and this would be one of those examples of the grant funds being available, both the admin and the grant itself through fiscal year 2027. But then there's another component in the bill that has a small rate increase, which results in the ongoing funding. So moving next to line 729, this is a proposal from Senate File 1201 that eliminates parental contribution fees for TEFRA. This is the federal proposal, or TEFRA is a federal act, and this proposal has a fiscal effect of just over $21.2 million in the 24-25 biennium and just over $26.7 million in the tails. Moving next to line 737, there's a proposal from Senate File 1272 that Senator Hoffman mentioned in his opening remarks related to MAPD premium modification and asset limit elimination. So this proposal has a fiscal impact of $78.3 million in the 24-25 biennium and just over $504.4 million in the tails. So moving next to line 745, this is a proposal from Senate File 1640 that establishes a funding mechanism for PACE. This proposal is funded at $265,000 in the 24-25 biennium. So moving next to line 751, this is a proposal from Senate File 1765 related to emergency grant program for autism spectrum disorder treatment agencies. So this provides grants, to clarify. So this proposal is funded at $21.15 million in the 24-25 biennium, and these are one-time grants. Moving next to line 757, this is a proposal from Senate File 1769. So this adjusts the property rate payments for a nursing facility in Fergus Falls. This proposal has a fiscal effect of $412,000 in the 24-25 biennium and $603 in the tails. So moving now to page 18, the next proposal included is on line 763. This is a proposal from Senate File 1788. This is a property rate payment increase to certain nursing facilities. This proposal is funded at $695,000 in the 24-25 biennium and $875,000 in the tails. So I'll note here the nursing facilities that are included are those with a project approved prior to January 1st, 2020, but were not completed by January 1st of 2020. So per the fiscal note, this would apply to 3 different nursing facilities. So this would be Chosen Valley Care Center, Ling Bloomston Care Center, as well as Viewcrest Health Center. So moving next to line 767, this is a proposal from Senate File 2477 that provides a property payment rate increase for Chisholm Nursing Facility. This proposal has a fiscal effect of $106,000 in the 24-25 biennium and $112,000 in the tails. The next proposal is on line 771 from Senate File 2896 and provides a rate increase to the Red Wing Nursing Facility. This proposal has a fiscal effect of $249,000 in the 24-25 biennium and $461,000 in the tails. Moving next to line 775, this proposal provides a grant to Boundary Waters Care Center, which is a nursing facility. This proposal includes a one-time grant of $250,000 in fiscal year 2024. Moving next to line 779, this provides a total payment rate increase for nursing facilities, and this proposal is funded at just over $74 million in the 24-25 biennium, and just under $47.4 million in the tails. Moving next to line 783, this is a proposal from Senate File 1902 that establishes Live at Well Home grants. This is another one Senator Hoffman mentioned in his opening remarks. This proposal is funded at $63 million for the 24-25 biennium, so these are one-time grants. Moving next to line 792, this is a proposal from Senate File 1926, which relates to the county cost liability for civilly committed persons being discharged. So this proposal the state would cover 50% of the costs that counties currently are liable for, and the fiscal effect of this is $6.59 million in the 24-25 biennium and is ongoing. Moving next to line 796, this is a proposal from Senate File 2244 that provides an appropriation to the Senior Nutrition Program. The total amount funded is $32 million, and these funds would be available through fiscal year 2027. Moving next to line 802 on page 19, this is a proposal from Senate File 2397 that establishes supported decision-making grant program. This proposal is funded at $4.558 million in the 24-25 biennium, and the grants are one time. Moving next to line 809, a proposal from Senate File 2529. So this would support rate creation for housing support rate creation for Douglas County supplemental housing. And this proposal is funded at just over $2.1 million in the 24-25 biennium and just over $2.95 million in the tails. Moving next to line 813, this is a proposal from Senate File 2944, and this establishes a pilot project for the Direct Care Services Corp. So this would be a one-time fiscal effect of $500,000 in fiscal year 2024. Moving next to line 817, this is a proposal from Senate File 3050. So this provides an appropriation to White Earth Nation for a digital therapy tool. This proposal is funded at $4.144 million in the 24-25 biennium and is one time. Moving next to line 823, this is a proposal from Senate File 1568. Provides a grant to Wellness in the Woods. This proposal is funded at $200,000 per biennium and is ongoing. Moving next to line 827, this is a proposal from Senate File 1391. The proposal provides self-advocacy grants for persons with intellectual and developmental disabilities and is funded at $646,000 per biennium ongoing. Moving next to line 832, this is a proposal from Senate File 2630, which provides a grant to Family Enhancement Center, and this proposal is funded at $400,000 per biennium ongoing. Moving next to line 836, this is a proposal from Senate File 2362, which provides grants to the Metropolitan Consortium of Community Developers, and this is for direct service professionals recruitment. And this proposal is funded at $350,000 and is one time. Moving next to page 20, this proposal, the next proposal included is on line 840. This is a grant to Family Voices in Minnesota, and it's funded at $150,000 per biennium ongoing. The next proposal is on line 844. This funds a motion analysis advancement and clinical study, as well as patient care, I believe to the Mayo Clinic, and this is a one-time funding of $400,000 in fiscal year 2024. The next proposal is on line 848. It relates to Anoka County Community Services complaints and noncompliance. This proposal is funded at a one-time cost of $10,000 in fiscal year 2024. So moving next to line 852, this proposal provides a grant cancellation and carry forward for research access to long-term care services. So this would have a fiscal effect of $300,000. The net effect to the target would be zero because it's because of how the targets are structured, but would show a $300,000 cost in fiscal year 2024-25. So moving next to line 856. So this is a proposal that was originally included in Senate File 1692 related to home and community-based services workforce development grant eligibility. So this proposal expands eligibility and as it is currently reflected in the appropriations article, it's possible that this proposal may end up resulting in a cost being carried forward due to the cancellation amount in fiscal year 2023. We have reached out to MMB, but we don't have a specific figure for this amount or whether there would actually be a cost associated with it.
And Mr. Raymond, you and Mr. Monahan and Mr. Nauman will work with MMB to get that figured out.
Yes.
Mr. Chair, I think we have a mechanism and a path to make that a no-cost item.
Thank you. Continue.
Thank you, Mr. Chair. So moving next to line 858, this is the same proposal. I represented it on two lines to expand the eligibility. So I'll skip over that one. So moving next to line 860. So this is a proposal that just makes modifications to the adult foster care moratorium and has no fiscal costs associated with it. And similarly, moving on to line 862, this is a proposal that makes exceptions to the moratorium for customized living settings. So that's all the proposals under the Department of Human Services. Now moving on to other agencies. Starting on line 1006, this is the funding for the Council on Disability, and is the funding is just over $2 million in the 24-25 biennium, and just over $2.49 million in the tails. So moving next to line 1016, this is the funding for the Department of Management and Budget. The total included is $1.8 million, and that's ongoing. And this is for an Office of Addiction and Recovery, and includes both this was originally a governor's proposal, was also included in Senate File 2146, and then the bill before you also adds an additional FTE for this office, which is represented on line 1019. So moving on to page 21, line 1021, this is the funding for the Ombudsman for Mental Health and Developmental Disabilities. The office is funded at $2.645 million in the 24-25 biennium, and just over $2.76 million in the tails. So finally, moving on to line 1027, this is funding for the Department of Employment and Economic Development. This is a one-time cost of $4 million. So this is related to what I mentioned earlier about Senate File 993. There's a public awareness, a recruitment campaign for direct service professionals included in that bill, and that is represented here, and is $4 million in fiscal year 24-25, and is one time. And with that, that concludes my remarks for the spreadsheet.
Thank you. If there are questions from the committee at this point, or do we continue? Mr. Monahan, you going next, or?
Mr. Chair, members, I was asked by the chair to hit the highlights of the bill language. 4.
Before you proceed, Mr. Monahan, Senator Westrom has a question, I believe.
Mr. Chair, just briefly, one of the line items that was reviewed a little bit back was regarding Douglas County and an adjustment to the rate. Is that relating to the teen challenge or the housing of alcohol and other types of services that go along with housing rates? Organizations such as that?
Did you have a question about that, Grant, or?
Mr. Chair, it looks to me like that's language that's helpful for the adult and teen challenge facility that's being built in Douglas County, and I just wanted to verify that. I know Senator Rasmussen's been working.
Mr. Chair, and to Senator Westrom, yes, the answer to that is yes. Senator Rasmussen brought a few components that we're looking at getting to where you're going on that. That is correct.
Thank you.
Thank you. Any further questions, Senator Westrom? That was just clarification you wanted?
That's it.
If so, then go ahead, Mr. Monahan. Go ahead, proceed with the walkthrough.
Mr. Chair, members, you should have in your packets 2 documents. One is the bill index, which is shorter, and then there's the bill summary. As I mentioned earlier, I was asked to hit the highlights, but I'll just mention for the bill index, many of the entries on these in the right-hand column is a reproduction of a line from Mr. Raymond's spreadsheet. So if you want to find the language associated with an item on the spreadsheet, you could find an electronic version of this and search it for the title of that line, and then the right-hand column will show you where the corresponding language is. I'm going to work for my own sake off the summary, hitting the highlights. I was told to keep it brief, so I will try to do so. So starting with Article 1, I'll mention the sections and not the page numbers, if that's acceptable. So Article 1, Sections 1, 2, and 3 are the substantive changes related to the creation and funding of the Long-Term Care Access Fund. Again, I'm just trying to hit some of the highlights as I understand them. On line 10, or I'm sorry, section 10, so I'm on page 3 of the summary. Sections 10, 11, 12, 13, and 15 are all grants aimed at trying in various ways to increase the workforce for services provided to people with disabilities and older adults. Sections 16 through 19 of Article 1 is the language related to permitting PCAs to drive their clients, which has been an issue at the legislature for a couple of years. On page 4 of the summary, Section 25 is the first of 3 sections that all increase the number of weekly hours that parents or spouses are permitted to provide services to their own spouse or minor child. Sections 29 through 44 are all the sections related to all of the changes to DWRS. That statute, as many of you, well, none of you may know, but as many of us know, are very convoluted and very complicated, and lots of proposals get shuffled in together. But I've tried to lay out in the summary where each of the particular components of the changes to DWRS occur. I'll mention 3 in particular. Section 31 is the base wage index change. Section 33 is the inflation adjustment change, and Section 37 is the increase to the competitive workforce factor. Those three changes constitute the majority of the rate increases under those sections, but there are others as well. Sections 46 and 47 are the ICF-DD rate increases. Sections 51 and 52 are the changes to the CFSS rate framework. Many of you will recognize this as rate increases for PCAs. The name of the program is changing, and this is where the language for the rate changes appears. Section 53 is the language related to the rate increase for customized living provided under what are called the CADI and BI waivers for people with disabilities. Sections 58 through 60 are three provisions related to the implementation of the contract between the state and SEIU with respect to individual providers, or generally speaking, PCAs, though not exclusively PCAs. Section 66 is the temporary grant for small customized living providers to assist them with licensing transition from typically assisted living licensure to licensure as a community residential setting or an integrated community support setting. Moving on to Article 2, the Aging Services article. Section 1 is the language related to the Live Well at Home grants. I'll note here that the majority of the language that appears as if it is new language in that section is not new language. It is language that is being moved from a different section of statute in order to integrate 4 different grant programs into the single Live Well at Home grant. The only real addition is an option for prior recipients to submit a grant application to continue their grant funding for another grant cycle. Section 2 is a separate grant program, though along a similar line, for caregiver respite services. Section 6, so I'm on page 9 of the summary now, are increases to the monthly service limit for essential community supports, as well as the inclusion of respite services as a covered service. Essential community supports, for those who don't know, is a sort of trimmed down version of the elderly waiver for people who don't qualify for elderly waiver or alternative care. Provides a smaller bundle of services for the same purpose, which is to delay or prevent individuals from having to access more expensive long-term care services. On page 10 of the summary, section 12 is a rate adjustment for critical access nursing facilities. This program existed in the past. It hasn't been implemented for many years. This was a governor's proposal. There was thought to be a need to assist some smaller residential nursing facilities. So the program has been revived but modified. Then sections 24 through 46, again, like DWRS, these are the changes to the elderly waiver rate setting framework. The framework is heavily modified based on a 2019 report from DHS. All of the changes are designed in one way or another to try to integrate data related to the cost of providing these services and then adjusting the rates in such a way that the rate will cover the cost of providing the service. And again, there are many, many changes included in all of those, and I can be more specific if you'd like. On page 12 of the summary, Section 49 is placeholder language, creating a general fund pool, which the commissioner is directed to use to pay temporary per resident day add-ons to nursing facility payment rates. And Section 50 is also placeholder language for an increase to the income limit for medical assistance for older adults and people with disabilities that would net out to $5 million per biennium. Moving to Article 3, so page 13 of the summary, Sections 1 and 11 are the elimination of the TEFRA fees for that are currently paid by the parents of children who are accessing medical assistance through a federal law that's referred to as TEFRA that allows children with disabilities or chronic illnesses to access MA, even if their household wouldn't otherwise be eligible for MA. Section 4 are the changes to the Employed Persons with Disabilities program under MA. As Senator Hoffman mentioned earlier, this is a program that allows people who are employed to access medical assistance in order to access the long-term care benefits that are only available through medical assistance. This proposal would eliminate the asset limit and eliminate premiums, as well as make some other modifications to the program related to paying Medicare premiums on behalf of the enrollee and allowing people who had previously been excluded from the program for failure to pay premiums to re-enroll now that premiums are no longer part of the program. Sections 5 and 6 are the NEMT and ambulance rate adjustments related to the base rate and mileage rate for NEMT and the fuel adjustments for NEMT and ambulances. Sections 7 and 8 are the establishment of a new MA benefit related to hospice care, hospice respite and end-of-life care for children. I'll note that the language as currently written states that if federal participation in this MA benefit is not approved, that the benefit will be provided with state-only funding. Moving next to Article 4, page 14 of the summary. The first 3 sections are related to the Office of Addiction and Recovery. This is the language that Mr. Raymond mentioned. It blends 2 proposals, one by the governor to create this office in MMB and a separate proposal that had created an office for youth addiction and recovery at the Department of Health. That proposal was modified to include that creation of that function in the newly created Office of Addiction and Recovery. The majority of the rest of this chapter or article is related to a governor's proposal to ease the administrative burden on providers to provide substance use disorder treatment services. But if we move to page 16 of the summary, sections 26 through 30 are the establishment of a Board of Recovery Services. Their general duty is to certify recovery community organizations, and peer recovery support specialists. Section 31 is the codification of a new ongoing Project ECHO grant. Sections 33 and 34 is language related to what Senator Westrom asked about earlier, the supplemental rates for adult and teen challenge, both in Douglas County, which he asked about specifically, but also a facility in Crow Wing County. Moving on to Article 5 on page 17 of the summary. These are a number of proposals related to addressing the opioid epidemic. I'll note that sections 1 and 3 were both deleted in the amendment that was adopted earlier. Section 2 requires schools to maintain 2 doses of nasal naloxone on site and requires the Commissioner of Health to develop a training video to train the staff. Section 4 requires that correctional facilities have procedures in place to deal with an opioid overdose emergency. Section 5 requires community corrections programs to maintain 2 doses of nasal naloxone on site. And Section 6 requires the Commissioner of Corrections to require that individuals with a known or stated opioid use disorder be provided with emergency opiate antagonist rescue kits, some form of naloxone for their own benefit. This article also includes a public awareness campaign related to substance use and a overdose surge alert system, which would be a text messaging system similar to perhaps Amber Alert system to notify the community that there's been a surge in overdoses in the community.
Mr. Monahan, or Senator Hoffman, can I interrupt on that just to ask for clarification? In effect, if there is fentanyl waste in a number of things and there are a lot of overdoses happening, to alert the community, be extra careful.
Correct.
Okay, thank you. Continue.
So related to those opiate antagonist proposals I mentioned, the last item in this article that I'll point out is the opiate antagonist training grants. So money is appropriated for schools, correctional facilities, treatment programs to train the staff to recognize the signs of an overdose and how to administer naloxone. Article 6 are Senator Hoffman's changes to the opioid prescribing improvement program. The major change that I will point out is Section 4 is the repeal effective June 30th, 2024 of the opioid prescribing improvement program. And finally, Article 7 is related to county shares for the cost of care of individuals who are civilly committed but do not require the level of care in the setting that they're in. Under current law, a county is responsible for 100% of the cost of anybody who's in either Anoka Metro Regional Treatment Center or a state-operated community behavioral health hospital. If that individual doesn't require the level of care, the changes in the bill say that if the person has been civilly committed as dangerous to the public and there's no opening in a state-operated facility, presumably St. Peter, then the county is only responsible for 50% of the cost rather than 100% of the cost. And that concludes the bill other than the appropriations article, and I'm not quite sure what the plan is for walking through that.
Do you want to go through that, Mr. Raymond?
Thank you, Mr. Chair, members. So with the appropriations article, I've already gone through essentially, during my remarks for the spreadsheet, I incorporated and made comments to reflect, necessary information that are included in the appropriations article. However, there are two additional items that I just wanted to mention that weren't reflected in the spreadsheet. And both of these relate to, these are funds that were included in the base that are ongoing funding that are just have specific language for specific purposes. So the first one is on lines, and I'll reference it. This is in the A28 amendment. So on lines 20.10 through 20.20, this is lottery prize fund money that is for problem gambling. And then there's a second instance on lines 22.13 through 22.17. So this is for the Office for the Ombudsman for Mental Health and Developmental Disabilities. This is ongoing funding for University of Minnesota Department of Psychiatry monitoring. So those are the only two additional items I had to bring to members' attention.
Thank you. I did have a question, Senator Hoffman, on page 19 of that amendment. One of the the startup and capacity
19.18.
building grants for treatment, it goes until June 30th, 2029. Do you object to moving it back 2 years, because that's the way we like to not carry out grants too long?
Only, Mr. Chair, if I may, if Mr. Albright is the one who found that, then maybe he should come down here and explain it in full detail. I'm only kidding, Dennis. You don't have to do that. Mr. Nauman pointed that out, and if you want somebody who forgets more in a day when it comes to this bucket of work that we do, and Dennis Albright, if he found that, then absolutely, it's good to go.
Good catch, though. Senator Champion, would you move on page 19, line 18 of the A28 to change 2029 to 2027, so it keeps it within the 4-year thing?
That's my motion, Mr. Chair.
Thank you, Senator Champion. Is there any discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. Senator Hoffman, I wanted to say that when I didn't realize you had in the bill of elimination of TEFRA fees and also the asset limit and other change for MAEPD, you're going to save so many people so much hassle. It's been a sore point for a lot of years. So, and we're not just reducing them, the fees, we're getting rid of them. So, about time. Thank you.
Mr. Chair, I appreciate your comment, and I take that wholeheartedly and authentic, that I was going to try to be funny about if you'd give me more money, I could have done more. But, you really, and you need to know, Mr. Chair, and I know we're going to go into some amendment things that we need to take care of, which I assured you we do. But then, when we're done with that, I really want to spend some time really getting into the narrative. But Mr. Nauman and Mr. Chair, the two gentlemen sitting next to me just are an invaluable asset to the state of Minnesota. And this is not an easy conversation to have. Human services is not easy. I mean, and I mean that wholeheartedly. This is where passion comes in front of everything else. And Mr. Monahan and Mr. Raymond have just been an invaluable asset to our committee. But I think the state of Minnesota needs to understand that you need to give them a raise, Eric. That's all I got to say. So thank you, Mr. Chair.
And I can second that, knowing how many short nights they've had recently because of trying to keep up with all of the amendments. Thank you both.
And Mr. Chairman, I just add one more. And Mr. Albright, who has been a mentor throughout this whole process, because this is my first time and Mr. Raymond's first time in doing this. And Mr. Albright is the reason why this ship is moving the way it is because he's got all those years
We
of
will thank him in absentia for
make him come in a tie.
Yes.
So, all right.
We're all learning as we go. We have several other amendments I wanted to discuss, and I know, Senator Hoffman, you want to speak to this one at length, or you want to speak to this one at least, but the A24 amendment, which deals with the forecast provisions at the beginning of the bill. And I'd like, if Senator Friends, you got your camera on, it says here your name, that you might be willing to move the A24 amendment?
Sure.
And this would take out the provisions that would take money that it comes out of the forecast, if the forecasts are positive in the next year or so, because it's not, we have not budgeted that way, and I have concerns about that. But I know you put these in there for a purpose, Senator Hoffman. I wanted to know if you want to speak to that for a minute or two, or so.
Mr. Chair, thank you, and I appreciate the conversation you and I had the other day. When you look at the fact that, you know, the provision of capturing the Medicaid funds that are underspent, every time throughout the history of listening to underspent, we underspent, these are underspent. Well, that means that something was originally budgeted to go to X, and that X could be, I'll give you a real-life example. Children living with autism. And I can give you one anecdotal story of 1,353 children that live with autism that were supposed to get a service, but because of how it was established, they were unable to get those services. And so that money that was budgeted for those services, instead of staying at the Department of Human Services, which I'm going to just pause for a second and tell you why I'm saying that deliberately and loudly. We've put so much pressure on the Department of Human Services in the last 10 years to do so much work. Matter of fact, if you look at a chart that shows their responsibility, given the fact that for the first time in history of 1.3 million people 65 and older, and our K-12 education population is actually decreasing, we've got this silver tsunami, and I have a statement in here I'm going to make later with your permission, but what you have is the Department of Human Services has an increased responsibility, 245D licensing, for example, Senator Marty. The statute says 60 days the license must be occurred, right? But because of the fact they don't have enough staff to process the intensive paperwork and the intensive licensing follow-up, what you end up having are people waiting months to do a service under the umbrella of 245D. That's a waivered service program. And so what I really originally want people to really understand is if you're going to budget something, and I say this because of a presentation this year, there was $1.125 billion of underspending that the department had of last year. You add to that the federal medical assistance program dollars that should be going over there, but they weren't spent, right? Instead, you had underspending total of $1.825 billion and change. I might be off by 20%, and if so, somebody smarter than me will tell me. But the fact is, that's not the important piece. The important piece to me is you have underspending that occurs that was budgeted for one thing. And yet we have this deep need, and the Department of Human Services needs to have some relief, because every time they have a problem, they come to the legislature to try to get that fixed, and there's always a battle about, well, you don't need the FTEs, but really they do need FTEs. But not only that, but when you see in here lines that have to deal with over the forecast that would be covered, you know, for example, there's a $4 million deficit payment that's going, right? Well, that's coming out of this year's bucket. If you would establish a trust, like most people put a trust in, that would have certain parameters around it, then it would alleviate some of the concerns and issues that are out there, i.e., why are people still waiting for their licensing to do? It's nobody's fault but the system's fault, right? And so my point is that when you really allocate to the sector and the sector gets to keep that and support that, then what we see, these gaps and these ailing problems that are out there, really help create that more healthy stability in our system. And let me just remind you again, 1.3 million people 65 and older are here in Minnesota, and that's not going to get any better, Mr. Chair. And so there's my 2-minute piece on why I believe what we did is not only the right thing to do, but I'd like to get some options about it. And I know the department has had some options. There's 3 various options that I have looked at this year, right? And there's no reason why we should, on the backs of people with disabilities and on the backs of the elderly in the state of Minnesota, balance somebody's budget. To me, that's just not okay. And so that's my point, Mr. Chair. And here's one more thing I want to tell you. The silver tsunami and the long-term care crisis is more certain and potentially more devastating than any future potential recession. And so with that, Mr. Chair, I just want to make sure that point was clarified. And I would like to get some help from MMB instead of them just coming and saying they got concerns. I'd like somebody to come and say, you know, we have an issue and it's an obligation to take care of our elderly, people with disabilities, and children in Minnesota. Let's find a way to do that correctly. And I appreciate your time on that. And with that, do what you need to do with those amendments, Mr. Chair.
And Sir Hoffman, I appreciate your passion for trying to fix these problems and your creativity in trying to find ways to do that. As I indicate, we don't feel that this is a way to budget, but I think that, I don't mean to dismiss it that, okay, therefore we shouldn't do it, but we can't leave the problems there, because as I point out a couple of the things that you are really fixing in here, and as you've discussed many times, the shortage of numerous problems we have with the lack of people able to provide care because they can't afford to do it.
And Mr. Chair, may I add, the only time DHS or the Human Services makes the front page of the Star Tribune is when we have a problem. And nobody ever talks about these issues that have been underlining like this, and it's time we correct that. People are dying. I don't want any more dentists. I don't want any more people dying because they couldn't get home health aides or that they were hospitalized and they had their legs amputated because they had bed sores because nobody could come to their home and help them move from their wheelchair to the bed, so they spent 24 hours a day in their wheelchair. Those are real people. Those are real Minnesotans. Those are real lives. That's what our committee focused on this year, Senator Marty, was how we're going to make a difference in the people, the unique and individualized needs of people that live within our care and jurisdiction. So I appreciate your time.
Thank you. With that, if there's no further discussion on the 824 amendment, all those in favor say aye.
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 Opposed?
Aye.
Opposed? Motion prevails. I had one other amendment that we've been putting on other bills. Senator Murphy, the A27 amendment, which the grants amendment that we've been putting on for accountability purposes. Senator Hoffman, we've discussed this with you, I think, and I think this is a helpful thing, and I think we're going to make some difference, make sure we don't have agencies that are, I think DHS does a lot of grants. I think it's in the packets, isn't it? Yeah. 827 is in the packet. Are those online accessing it, I hope? Okay, it should be posted. Anyway, Senator Murphy moves the A27 amendment. Is there any discussion of that? If not, all those in favor say aye.
Aye. Aye.
Opposed? Motion prevails. Were there
You have an A30 and an A29, I think, Mr. Marty. I'll speak to both of those. Or it's 831, I'm sorry.
831 and 829, are those, they are not in the packets, so. Mr. Nauman, do you have?
Mr. Chair, I'm just looking for clarity on what's being offered.
A29?
Yes, I have that, Mr. Chair. Just a moment.
And Senator Hoffman, do you know what A29 is?
Mr. Chair and members, I sure do. After getting home at 3:15 this morning and getting up at 6 o'clock this morning, I spent the next 3 hours on the phone with multiple people. And Mr. Chair, I know there's a couple of things. Section 42 is established in Minnesota and in the United States to give federal tax credits to organizations that build affordable housing. And there's a organization that, I'm not calling them out, but if anybody wants to, they sure can, who decided to go with what the legal law allows them to do, which is to raise rents according to the average median income. We have a problem with AMI, right? If you truly want to look at AMI, you should have actually two different sets of AMI. You should have one that's related to senior citizens AMI, and then you should have one that's related to others. So for example, when you have an AMI, an average median income, that increases 12.8% in an area, by the law, you as an organization, who, by the way, Mr. Chair, this organization, and many like it, when they build, say, a $30 million apartment complex, 1/3 of that, actually more than 1/3 of that, gets to be given back to them in federal tax credits, right? And so they're being able to bank upon federal tax credits as long as they provide certain things. But one thing that has always existed out there is the ability for them to raise their rents on the AMI. And what those individuals will tell you, but there's a risk, Senator Marty. There's a risk because let's say the average median income actually dips down, then they have to lower their rents. That's a true statement, right? But yet at the same time, I can give you examples after examples. Every senator I know personally know, has a program that's Section 42 in their area. And Minneapolis, for example, there's one provider who actually had a town hall meeting and discussed about what the actual needs, the needs were. And instead of going with the AMI in Minneapolis, they actually, as a community, said, well, we need to cover our costs. They raised their rents 5%, right? They decided to do that. Another one, which Mille Lacs Corporate Ventures, which if you look at, not only do they have a wonderful single-payer healthcare system that actually works, called the Circle of Health. If anybody wants to look that up, they sure can on a Google search. But they also provide Section 42 housing. And lo and behold, Senator Marty, their mission and vision on why they built that housing stays true to form. They don't raise their rates 12.8%. And so yet a company who says, we are doing this because we legally can, just to me doesn't justify what their ethical responsibility is, especially when they're supposed to be going in at this to provide an opportunity for housing that's affordable, right? And Senator Marty, I realize that this conversation is deeper than just our committee. And even though I had put in, made it fiscally germane and jurisdictional to this discussion, I understand it. Bring It Home is a permanent assistance program that's funded at $150 million. That might help some of these folks, Senator Marty. And these folks I'm talking about that live in Coon Rapids, Champlin, Anoka, Cottage Grove, Minneapolis, I could start naming a whole bunch of the areas. They're paying up to 75% of their rent is what they make. 75%. 75%? How many of you can live on paying 75% of the money you take home for your rent? You can't. So here's what their problem is. You have elderly people that should be parking in a covered parking lot underneath the building, but because it's a $50 to $75 fee, which my understanding that should have been included, although it's my understanding, it should have been, my understanding, right? I could be wrong, so I'm not making any statements that might have somebody say, well, you said something wrong. But it is my understanding that it should have been included. So you have somebody with a mobility concern parking in a Minnesota winter out in their parking lot. And what's one of the biggest reasons that our elderly get into some long-term care problems is because they fall. They fall. Hence, there's a grant in this bill that gets to the Mayo Clinic. A doctor down there in his mobility lab, he's got it. He's got these things. He's doing it. We want to give him a little bump, and that's what we're doing. But let me go back to my point, Senator, that if you're going to raise the rents 12.8% and then sit there and tell me in a personal meeting in front of a representative who's over in the House and the other body that you're doing that because you're legally okay to do that, doesn't say anything about your mission or vision. So I want to make a point and a highlight that you cannot sit there and tell me that it's okay for you to do a money grab on behalf of the taxpayers of Minnesota and the United States and then say that you're doing a service, and you're really not doing a service, Senator Marty. The point in front of you, and I realize that this bill is moving to a different committee, so it's still active, it's still alive. I say to you, thank you for this time to talk about that. But I'm tired, just like I'm tired of balancing budgets on the backs of people with disabilities. I'm tired of those that saying they're providing a service only to just stick it in your eye. So Senator Marty, I did not mention who the company is, but I do know who they are. And believe me, if they don't come to the table and start wanting to be ethical about their life, I will bring a bill every 2 weeks until I'm gone from this body to get it right.
Senator Hoffman, I hope they do agree to meet with you and address this in a better way in the future. Thank you. Senator Pratt moves the A29 amendment.
Mr. Chair.
Senator Pratt.
Thank you, Mr. Chair, and thank you, Senator Hoffman, for your comments on that. And I know this has been a passion, a driving force for Senator Abler as well. And I wanted to recognize Senator Abler's efforts in this because I believe this started in his district, but it's hard to tell because you guys are so close together. I see your campaign signs on each other's properties, but the concern that I had with the amendment was how narrowly written it was. And as Senator Hoffman said, it really wasn't supposed to be in this bill. And if you're going to be carrying it forward through the right committees, then I appreciate that you're taking it out of this bill and allowing this to move cleanly. So thank you.
Thank you. On Senator Pratt's amendment, is there any discussion? Senator, people online do not have the A29 amendment. So I will just tell the people online if it helps, because the amendment is very simple. It's page 118 of the bill, delete section 52, which is a section, senior housing related stress and mental health prevention is the title of the section. Senator Mohammed, you had your hand up.
Thank you, Chair Marty, and thank you, Senator Hoffman, for bringing your voice to this important issue. It's something that we've talked a lot about in our housing committee, and I certainly share your feelings on the fact that rent is too high and folks in our communities are struggling, especially people who are seniors and don't speak English as their first language, people who are living with disability, and we have companies who are taking advantage of that. And that's been clear, and I'm really glad that you brought some attention to the Bring a Home bill, which is something I've worked on this entire session. We've secured $150 million one time for it and $20 million ongoing, and I'm really glad that we're going to be joining forces to make sure we get more money for that, to ensure that we house people and take the folks who are taking advantage of our communities, make sure that they don't do that anymore, and that we confront them and make sure that Minnesotans know what they're doing. So thank you.
And with that, I want to make sure, because I want to make sure that all the members who are on the Zoom have had access to the amendment. It's just simply deleting section 52, and it was just emailed to you, but I hope you have it. Okay, if no further discussion on the A29 amendment to delete section 52, all those in favor say aye.
Aye.
Opposed? Motion prevails.
A31, Mr. Chair.
A31 is one, okay. Senator Hoffman, it's being distributed, and it has been emailed to the remote.
Mr. Chair, I can have Liam Monahan explain the change. It's a real simple change. It's very
Mr. Monahan,
clarification.
please go ahead and explain it. I think at least members in the room have received it, and others should have it online. So go ahead, Mr. Monahan.
Mr. Chair, members, the changes, there are two changes represented in the amendment. it was easier for us to delete the entire subdivision and then reinsert the amended version. So I'll describe the changes. In the original version, folks who had received, or organizations or communities that had received a Live Well at Home grant, which are temporary grants, were given the option to apply for an extension of their grant. But paragraph B of that subdivision limited which organizations that had previously received a grant could apply for an extension of that grant. And it confined it to prior grantees who had an operating budget of $300,000 or less, and also had some language about filling a gap in services. And it was thought, A, that the limit was too low, and the decision was made by Senator Hoffman to eliminate that restriction, as well as the restrictions about filling a gap, because if an organization had gone in and filled the gap with their prior grant, there was no gap, so they wouldn't qualify. So they eliminated paragraph B. The second piece was that the series of cross-references to the other subdivisions of this section omitted one of the sub-grant categories. And that was because the original version, they thought that that sub-grant or subcategory of grant only applied to capital costs. But that's not true. There are other activities that could be funded beyond capital costs. So they included that sub-grant but excluded capital costs. You can't get paid twice for the same capital costs, but you can get continued funding for the activities and programming that you're providing. So those are the two changes.
Okay. And Senator Mohammed, will you move the A31 amendment?
So moved.
Is there discussion on the A31 amendment? And I believe all remote voting members should have it as well. Is there any discussion on the A31? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. I don't have a list of other amendments. I'm sure others may, but first of all, are there other discussion of the bill right now, or people have amendments they want to offer? Senator Murphy.
Thank you, Mr. Chair, and I don't have an amendment. Just an observation as we've gone through the document, the spreadsheet and the summary, it is really clear to me that this bill does a lot of good and hard work for people who get their care through a variety of places, particularly people with disabilities and people who are aging, children. And I think that is one of our chief obligations in this body. It also has its eye on the people who do the work, and we can't provide decent care if we're not thinking about the workers. And I'm really glad that I'm here this afternoon to have a chance to go through the bill, to hear it from its author, and to cast a vote for it, because it is, from my perspective at least, really good work for Minnesota. And I'm glad to be here. Thank you.
Thank you. Senator Pratt.
Thank you, Mr. Chair. Senator Hoffman, I appreciated your discussion around the gray tsunami and some of the underfunding that we're seeing in our nursing homes. I sit on, as you know, I sit on the board of St. Gertrude's Long-Term Care and Rehabilitation Center, which does tremendous work in Scott County, making sure our senior citizens and really our senior citizens with the greatest needs are treated with respect. We work hard and tight budgets to not only retain our staff, but to recruit new staff along the way. And we had quite a discussion about that just a couple of weeks ago when the Earned Sick and Safe Time bill was up. When the bill was in your committee, you had added a provision that required the state to fund the cost of those sick days. And if I recall, that was about $100 million. It never got, the fiscal note never got published with any number that was publicly available, but I think offline, you and I talked about that was maybe about a $100 million impact. $100 million that our nursing homes can't afford to take. And we stripped it out in this committee.
170.
170?
Yes.
It keeps going up every time we talk.
Sorry, Mr. Chair, I didn't mean that.
So, Mr. Chair, I'd like to offer the A32 amendment.
Senator Pratt moves the A32 amendment, which will be sent out to people in just a minute.
And Mr. Chair, while the amendment's being handed out, I'd like to amend the amendment as well.
Okay, well, we'll have you incorporate the change in it. As soon as people hand it out, you can tell us what change you would like to incorporate into it.
I think Mr. Nauman's calling a timeout anyway.
Okay.
Recess.
So, Mr. Chair, I'd like to amend, it doesn't change really any of the intent of the amendment, but on line 1.2 of the amendment, I would like to change the amount of $537,445,000 to be 280, I thought it was 287. Okay, 287,045,000. And then right below that, I'd like to add a new line where on page 114, line 26, we delete 37,045,000 and replace it with the same 287,000 or 287,045,000. And this is intended not to carry into the tail so that we allow, and as I've talked to fiscal staff, I don't believe it'll have a fiscal impact to the tails, but if it does, to allow the fiscal staff to make technical changes to assure it's a one-time appropriation.
Can,
Mr. Chair,
yes,
the
Mr.
net,
Naumann.
the net effect of this amendment would be to add $500 million in '24 and '25.
250 million a year for each fiscal year to nursing home funding, yes. Okay. And I can understand why.
So, Mr. Chair,
Go
to
ahead.
that. Mr. Chair, you know, I think this goes back to, well, I don't think I know, it goes back to a conversation that Senator Johnson had with your leadership. I'm not sure. Oh, I'm sorry. Looks like.
Senator Marty, Mr. Chair.
So, go ahead,
Mr.
sir.
Monahan, he's got a clarification on what you're, before you go into the amendment.
Okay, yeah, please. Mr. Monahan.
Mr. Chair, members, I think the page and line reference is oh, never mind, sorry. I was misreading it.
Okay, continue, Senator.
Thank you, Mr. Chair. Well, let's make no mistake. The Senate Republicans believe that with a $17.5 billion surplus, there is money enough for tax relief, for making sure our nursing homes are taken care of, and that the majority is spending way too much of our surplus. But we also have a $6 billion biennial surplus. And that is being spent to the point where we're having to increase taxes and fees by almost $3 billion. But what we had proposed, and I'm not aware that we've gotten an answer back from the leadership, I may be wrong. We had proposed that we move money out of the capital investment target into tax relief for Minnesota, for every hard work, or for senior citizens, to be able to fully fund the elimination of the Social Security tax, and then be able to provide significant relief and support for our nursing homes to help them cover the recruitment and retention costs that they're facing, to help them handle the fact that many of the reimbursements in the revenue that they're being paid is below the cost it takes them to provide those services, and to help cover the cost of, quite honestly, some of the other mandates that are traveling separately in this legislature. Now, I realize that it looks like it'll be a fiscal cliff in the next biennium, and my hope is that when we come back in the next biennium to do the next biennial budget, we'll have time to figure out how to make sure that this is not a cut in the long term. Because we still should be, as all indications are from the forecast, projected to be overtaxing Minnesotans. And if we're going to do that, I think this is a good reason. This is just one part of a plan to allow us to pass a capital investment bill that will help every senator and every representative's district. It's in support of the fact that we want to provide our senior citizens with tax relief by eliminating the double taxation on Social Security, and then providing $500 million to our nursing homes to cover the costs that they're underfunded and for the new mandates that are coming down. And Mr. Chair, I request a roll call vote with the results of the roll being printed in the journal.
Thank you. There are three hands I saw.
No. I was
okay.
raising my hand because I had something to say. I really wasn't raising my hand.
You don't care if it's, I don't care. Just so people know, the reason I haven't spent a lot of time counting hands each time is, first of all, there usually are at least three people willing to raise their hand. Second of all, printing them in the journal used to be a way of, this is really, really important, and we got to make sure we said, I think it happened about once every 2 or 3 years. Now it happens to about 3, 4, 10 times a week, so I'm not sure it has the same purpose, but if people want it printed in the journal, I guess I don't have a problem with that. But anyway, on Senator Pratt's motion, Senator Champion, you had your hand up, and I think
did.
others did too. Go ahead.
Thank you, Mr. Chair. What I will say is I share Senator Hoffman's, concern about this population and our seniors and others, and there's no disagreement there. As I share the concern about so many other folks as well, unfortunately, we don't always have boundless amounts of money, and I understand that. What I don't like is when we have something like the A32 amendment used as a way by which to take something we really that we care about and use it as an opportunity to invoke our political message. When we think in terms of Social Security, there are people who, believe that's important, and there's none of us who push back against that. We know that that the same people have not decided to raise revenue, even in years past when they were in charge, in order to meet this important need. But it's sometimes used like moments like today that I find unfortunate, because we should not be using something that is a heartstring issue as a political opportunity. And so I would ask that we not accept the 832. I know that there's always a conversation about what should or should not be done. But I just would ask that we not support the 832. And even though a roll call has been requested, I'm certainly willing to go on record to say no to the 832, but that's not a reflection of whether I think it's important or not. And so I just hope that we would all take that same spirit and not use this heartstring issue as a way to push for the GOP agenda. Thank you, Mr. Chair.
Thank you, Senator Champion. I see next, I have three more, I believe, have raised hands. I have in order Senator Murphy, Senator Dames, if he had his hand up, I'm not sure, and Senator Friends. So Senator Murphy.
I do not.
Oh, do not. Okay, thank you. Then Senator Murphy, then Senator Friends.
Well, thank you, Mr. Chair, and I recall the discussion that we had when Senator Pappas had her bill up. This is a different matter, and while I appreciate, and everybody seems to be acknowledging, Senator Champion just did, that the issue before us, when I hear the proposal to use one-time funding for an ongoing obligation, hoping in the next biennium that we wouldn't then face a cut, that feels not just gimmicky, and you're all dealing in all of these budgets with one-time funding and the impact in the tails for our budgets, and we are doing that in the budgets I'm working on as well. It's not easy, but it is the case. But to, with intention, set that up on something as important as the care of our seniors just is distasteful from my perspective. And I think this is an issue that I am sure Senator Hoffman's going to keep working on. And I think that's important, but I don't like this approach. And so I just want to be on the record on that point.
Here we go.
Senator Friends.
Thank you very much, Mr. Chair. Thank you, members. Thank you, Senator Pratt, for the 832. As someone who took part in some of those discussions, I think the best place for those discussions would be amongst Senate leadership of the majority and minority. I have the same feelings as all the other speakers to this amendment. I would ask members to vote no. And Senator Pratt, happy to talk with you anytime, as well as Senator Johnson, about the choices that we make amongst leaders and about the budget targets that we set. Having been in the minority for 6 years, I know it can be frustrating to have the majority make choices that the minority might not have made. Now that the shoe's on the other hand, I hope we'll continue to work together. And I'll give Senator Johnson a text and make sure that Senator Dietzick is following this as well. With that, members, I'd ask you to vote no on the 832 amendment. Thank you, Mr. Chair, and thank you, Senator Pratt.
And to clarify, because everybody's referring to 832 with the amendment, the oral amendment incorporated, so it would read page 114, line 25, strike the 37 some million dollars, insert 287,045. And line 26, the same thing, Mr. Nolan?
Mr. Chair, if you'd like, I can restate the
Please
oral
restate
change.
the amendment, and then we'll
So
have
on line
Senator Dragan.
1.2 of the amendment as written, strike the new language 537,045, 000, and insert 287,045,000. And then a new instruction that reads page 114, line 26, delete $37,045,000 and insert $287,045,000, period.
And that's the Pratt amendment. Senator Draheim has his hand up.
Mr. Chair, and thank you, Senator Pratt, for bringing this forward. You know, I know there's been some discussion about this being a political ploy, and you know, when we're out here in the rural areas, we're literally having nursing homes close every week, and some discussion last night about that, and you know, we're running out of runway here to get something done, and I don't see any other options coming forward from the majority. So I do think this is important to get done. So if not on this bill, which bill should we take care of this? Would be my question. Rhetorical, of course, but I urge agreement.
And before we vote on this, first of all, Senator Dames, because you are not on video, the rules require you to affirm that you have no access to a video connection or connecting only by audio, and then you're able to have your vote counted even though you can't be seen. Can you affirm that you?
And that is correct.
Okay.
I do affirm that. I do not have access to the video.
Thank you, Senator
And
Dames.
this is Senator Dames.
Yes, thank you. We will, your vote will be included in this. I just had to say that because that's what the rules require.
Yep, that's fair.
Thank you. And then Senator, I want to speak to two, and since you're the author of it, you
Okay,
can
thank
go after that. And I want to just point out that you said, well, we could take money away from bonding, which you highly prioritize, and we can still do all these tax cuts you want to do, and we can do all this extra funding for this. And bottom line is, I think Senator Hoffman's made a strong case on why nursing homes, not just that, but all sorts of other direct care, long-term care, other needs. The needs are very great, and we've got places who are struggling to find workers because they're not paid enough. I think that this bill is making a noble attempt to try and address that within budget targets. But when the concern is, oh, we're spending too much, but we have to spend more here, I'm willing to spend more on this stuff. I'd like to have us spend more on this. I think all of us care about this, but the bottom line is, last few months ago, I had asked MMB and Mr. Nauman and fiscal staff if they could tell me how much of this $18 billion surplus would be cut away by inflation from if you went back to the budget that your caucus as a majority passed with the House DFL 2 years ago. What would it take to continue that level of services? And as I think we all know, there's about $12 billion that's one-time money, largely because of COVID funds coming in and so on, but of the ongoing I think it was about $3 billion, the ongoing money we can use for budgets like this. Inflation, if we had factored in inflation, the part that we didn't know because they projected like 3%, and if it was 9%, and then 2.5%, and it was 8%, whatever it was those 2 years, if we were to keep up with the current level of services, we would have, of that $6.3 billion, we would have, 5.2 billion of that would have been eaten up by inflation. In other words, we had just over $1 billion of, quote, additional money. I always concerned the use of the term surplus. Oh, this is all extra, because I frankly think when we have housing needs and education needs and childcare needs, and agriculture and transportation and nursing home needs, I think that I have trouble seeing it as surplus, because that's what's left over. And I would love to put more money into nursing homes and so on, but trouble is the math has to work, and rhetoric about how there's all this money floating around and don't have to, why don't we do more for nursing homes? Well, they're hit by inflation. They're hit by all the other higher costs, and if we factor that in, we don't have all these billions of dollars. And so I just want to keep it in perspective that if we're going to do honest budgeting, and that's why we have to have budget targets, and this clearly doesn't fit within there. And I don't think anybody's been a better champion of this than Senator Hoffman and what he was trying to do in his bill, and recognizing it's, I think he's going to speak yet today about how we have a shortage of all the care providers who mean we don't have facilities that can take people in, and so the hospitals have overflow. So I think it's all a big puzzle, and I'm very concerned about it. So I sympathize with what you want to do in the amendment, but the numbers, math doesn't add up. Anyway, Senator Pratt, go ahead with your comments on it.
Thank you, Mr. Chair, and let me just share my disappointment in the tone and tenor of this conversation. This was a legitimate proposal that was put forward. The minority doesn't have an opportunity to set those budget targets. The majority does. And we've been trying to influence them. The fact of the matter is that the majority, instead of prioritizing nursing homes, put extra money into the budget for a cash bonding bill a bonding bill and a capital investment bill that Senate Republicans have been willing to support, provided we could get some confirmation, some commitment that we would eliminate the Social Security tax. In fact, Senator Frantz, when addressing Senator Johnson on the floor of the Senate, said we could afford to do more in tax cuts if you'd have passed the bonding bill. So we came up with a proposal. I'm offended by Senator Champion saying that this is meant to invoke a political message, and I wrote down your quote exactly, Senator Champion, and that we're using a heartstring issue as a political opportunity and to forward the GOP agenda. Those were your exact words. This is an opportunity for us to tell Minnesotans how we want to move forward. Throughout this session, Senate Republicans have been trying to make legitimate policy and financial contributions that have been rebuffed at every turn. At every turn. The majority has effectively ignored 49.5% of the state by not engaging with Senate Republicans who hold a one-seat minority. Senator Murphy's indignation that we create a fiscal cliff in the next year when we've done the same thing with the housing bill and other bills in this legislature. So we have a $6 billion structural surplus. Sir Marty, let's take the $1 billion in inflationary costs that you mentioned. We still have a $5 billion structural surplus. And despite everybody saying how much they love their nursing homes and they really want to fund them more, we can't afford to put 10% of that surplus into this program. This is a legitimate proposal, and I'm offended at everyone at this table who said this is not a legitimate budgeting, this is not honest budgeting, this creates a fiscal cliff that we've never done in the past. And Mr. Chair, I think I had the last word on my amendment. I see other hands going up. That this is just simply a political agenda. I'm offended by that because we put forth a valid proposal that as far as I'm aware, has never been fully addressed. And when we talked about this earned safe and sick time, we were told that when that proposal was taken out, we should address that issue when this bill comes up. That's what we're doing. So, Mr. Chair, this is a legitimate proposal, and I am offended at the tenor and the tone of the discussion and the debate over this amendment.
Senator Pratt, you will have a chance to respond again, but there are several people who want to respond, and I want to point out one thing just for clarification, and I had not attacked you for offering the amendment. I want to point out that when I talked about the inflationary impact, you got it backwards. It was 5.2 of the 6.3 billion was the inflation impact. There was 1 billion left. And of that 1 billion left, the Social Security tax cut would take far more than that on its own. Just so you're aware of that. That's not, you don't have to like it, but I'm just telling you that's what the inflation impact was if we go back 2 years and calculate what it would take to keep in place what was voted on by this legislature, which was a split legislature at the time, as you recall. That's just the numbers on that. But and Senator Pratt, you will have your chance to respond, but Senator Champion asked to speak on this as well, and Senator Mohammed, I believe.
Thank you, Mr. Chair, and thank you for Senator Pratt's words. I stand by what I said because the evidence is clear. And you may say to me, what evidence, Senator Champion? Because if the GOP was so serious about it, why does the care for nursing home comes after a tax break? If it was a priority, you would say, hey, before you give Social Security anything, give nursing homes that money. That's not what you said. And you haven't said it all session. Every opportunity you get up on the floor, you say, bring up Social Security. I have yet, Senator Pratt, hear you say, hey, let's bring up this first. There's $1 billion there. I haven't heard it. And the only reason why I thought it was more political is because you then introduced the whole notion of what's being discussed by our leadership. And the proposal to our Majority Leader, Dzik, is something that should be discussed amongst leadership. And I will remind you, not only did you all not bring it up as a priority this year, but once it became a political issue because we knew it was a heartstring issue for a member, now we started talking about that in a different way. Because in prior years, when you had an opportunity also to make it a priority by saying we care enough about it that we would raise taxes in order to get it done, because that's how much we care about this issue. We haven't done that in the past when the others have been in control. Now, the reason why I'm feeling a little challenged by even raising this today is because I know this issue is very serious to Senator Hoffman as it is to me and others. And I hate that he has to be in the middle of this sort of political shenanigans. And so with that being said, no disrespect to anyone, no disrespect to you, Senator Hoffman, because I understand the seriousness and how sincere you are about this issue. And it does not fall on deaf ears. But I do not want to be in a position of measuring pain, my pain to someone else's pain, my pain to someone else's pain. I don't want us to do that. And so I'm disappointed by the 832, but I respect the fact that the minority has a right to put it forward. And I wouldn't have said anything until those words were articulated and uttered from this table. So with that being said, I'll be quiet and I'll be ready to vote.
Senator Draheim.
Vote.
Oh. Go ahead.
Thank you. Thank you. Just to respond to the previous comments a little bit, I think both sides take this issue very serious. There are members on both sides of the aisle that have expressed concern about this industry for the 7 years I've been in the Senate. But I think what Senator Pratt's trying to get at on his amendment is dealing directly with new proposals this year that are moving forward, that most of us think will be the last nail on the coffin for a lot of nursing homes in Minnesota. They had a rough ride during COVID, and now with inflation being a key factor with them, their costs have gone up, their labor costs have gone up, and we all know that. But to blame previous years on something, mainly two bills that are moving forward right now that'll have a fiscal impact on that industry, I think this is just good governance, and I take offense to blaming previous year's actions or inactions on new proposals this year that are literally days away from passing. So that's all I had to say. I look forward to the vote.
Senator Mohammed, I'm sorry, I missed you earlier, and then Senator Pratt.
I'll be brief because I know we have to move on. Senator Pratt said something that kind of that I wanted to address, and that was that the minority is kind of maybe shut out of the conversation. They're not being heard in this. And I want to be clear that in this bill, particularly Senator Hoffman's bill, Senator Nelson's bills aren't here, Senator Rasmussen's bills aren't here, Senator Abel's bills aren't here. The jobs bill was reflected of their bills. And so the majority this session has heard the minority's bills in every single committee, and they're reflected in almost every single omnibus bill. I think the issue that you're speaking of is important, and I think we should address it. But today we're talking about taking care of our seniors, long-term care, nursing homes. We're talking about folks who are living with disability. And we can talk about Social Security tax elimination, but there's an omnibus bill here that is reflected of what the people of Minnesota elected us for. And we're choosing to not address that, but to rather address another issue because the minority feels like we haven't talked about it enough. And I think we have, and I think we're continuing to have those conversations. And I just want to recenter us in the fact that last night in the jobs bill, the minority voted against their own bills that we heard. In the Capital Investment Committee, which I am in, it was majority Republican bills. I barely had any bills in there, and I voted for it, and they voted against their own district. And so when we talk about we're not listening to the people of Minnesota, I just want to make it clear that the majority is listening, they're reaching out to the minority, that they're hearing their bills, and the minority is choosing to ignore it.
Senator Pratt.
Thank you, Mr. Chair. Mr. Chair, this is a legitimate proposal. I didn't say you attacked me. I said you said it wasn't honest budgeting, and it is. And it follows the budget rules. Senator Champion, it was disrespectful. This is not a political move. This is a move to try to say that we can do tax cuts, we can do bonding, and we can do significant good work for our senior citizens. And this is not a new proposal. It's been out there. So it's not as if it's coming out of thin air. And it comes from and Senator Draheim, Senator Dames, and others have been working on this issue for many, many years. Senator Mohammed, let's recenter this discussion because we haven't said anything specifically that Senator Hoffman's or bill has not incorporated some Republican ideas. In fact, he and Senator Abler have probably one of the best working relationships in the body. But let's recenter let's do recenter that our conversation here, because we're talking about the overall budget targets, and we're talking about a $100 million impact that was taken out 2 weeks ago that we were told should be addressed here. And this is the amendment that will address it. So I guess I'm confused, if you want to recenter the conversation, how we can take out $100 million support for our nursing homes, put $170 million mandate on them if that bill goes through, say we should be discussing that as part of the human services budget, and when I bring it up, I'm told it's advancing a political agenda. And you can say I don't mean any political disrespect all you want. It's disrespectful. I am sad. I am sad for the state of this body today. Mr. Chair, this is a good proposal to help our nursing homes. And it furthers the conversation that our leadership team can do. And I encourage a yes vote.
On the A32 amendment with the language incorporated in it that's been discussed a couple of times, those who are online with cameras, please turn on your video, and Senator Dames, please turn on your microphone. With that, the staff will take the roll on the A32.
Chair Marty?
No.
Senator Friends?
No.
Senator Pratt?
Yes.
Senator Champion?
No.
Senator Dames?
Senator Dames, yes.
Senator Draheim?
Yes.
Senator Eichhorn?
Eichhorn votes yes.
Senator Mohammed?
No.
Senator Murphy?
No.
Senator Westrom?
Westrom, yes.
Senator Wickland?
No.
There being 5 yes votes and 6 no votes, the motion did not prevail. Further amendments or discussion? Discussion of the bill. Senator Hoffman. Would
Thank you,
like
Mr. Chair and members. And a couple of things before I go into my comments. Senator Murphy, 20-some years ago, Senator Harkin and I came to visit you. I deeply am grateful for your comments that you just made here. It reminded me of what you said to him, verbatim, because I never forget anything. Just asked Senator Pratt, I'll quote Public Law 99-457 all day long. You said, thank you for putting health back on the radar. And that's what the conversation here that you guys just had, you just helped me put human services and health back on the radar. And I appreciate everybody's input on that. So as you see in this presentation, that we've done our best to support the entire continuum of care, from living independently with proper supports to those with the highest needs. We meaning our committee, which by the way, Senate File 7 is Senate File 6, which passed with 60+ votes last year, plus the additions that are on there. This is a nonpartisan approach to human services. We wanted to ensure as many people as possible had the care they needed when they wanted it and needed it. In human services, we support services that are part of a vast network that touches every part of life, from services for people with disabilities and our elderly that let them live with family on their own to more intensive facilities or group settings. As their care dictates, it impacts everyone. This is an important series of interactions that I don't think many are aware of, the interactions of these whole systems of care. So I just want to take a moment to explain, not to you, but to the 85 people that are watching this in Zoom land, and the fact somebody else is watching this that I hope says, you know what, I do care. If a service isn't available because rates are too low to recruit enough caregivers, a few different things can occur. When services are not available for an individual, their family may have to step in to take care of them. So their jobs, their schedules, and their finances do dramatically shift as they try to fill the gap as an untrained caregiver for their loved one. The individual may not receive the proper trained care, and the family and friends filling in the gap are doing all they can without the ability to be reimbursed for all their work. There are those who quit pursuing their college educations or who have left the workforce to fill a need we failed to provide. My wife, Yvette, is that person. And if it's a service where care is mandated, they end up in a hospital. And during this time, the hospital and county will attempt, this is their obligation, to find placement, whether in their own place or appropriate services or perhaps a congregate setting of some kind. If none are available, the hospital takes care of them until such is found. Key point, they are reimbursed for the days that the individual needs hospital-level care. After that, they're cared for by the hospital, but they are not generally reimbursed. And I'm going to give you 1 week in December, Senator Marty. The Hospital Association found that nearly 2,000 people were in this undischarged state, which at $2,500 a day is roughly $37 million of unreimbursed costs to our hospitals and our health systems. That affects people. Higher costs affect people. Backed up emergency rooms affect people. Frustrated patients assaulting workers affects people. People who leave the ER due to long wait times, not receiving the care they need, affect people. The inability to accept trauma transfers, leaving patients without the care they need, affects people. Our entire healthcare system is impacted by this backup in our long-term care system, both the health of those being held in a hospital where they don't belong and those who desperately need to receive the care. And who hasn't needed hospital care at some point? Whose family hasn't needed hospital care at some point? In the absolute worst case, someone doesn't have a family and friends to provide care and shelter, right? Somebody doesn't have the services that are desperately needed, services that are funded. You know where they go? They join the homeless population. Wilder Foundation has the statistics and the data to show you I am not wrong. I say all of this to bring you and to those listening and to others some understanding of how interconnected the systems that we have and that we provide to our vulnerable populations are. To everyone and to every system. I say all this to educate just how costly it is not to fully fund the system. And I say this to educate in that it's just how costly it is not to fully fund the system. I repeat that because what we truly need and what we got was not there. It can cost our healthcare system hundreds of millions of dollars a year to keep people where they don't belong. It costs families time and money to provide care they are not qualified to do. Lower healthcare outcomes for individuals receiving improper care at improper locations drives up our ER visits. Just go to the nearest hospital and see the nurses and the hospital staff triaging, not triaging, but actually doing care in the hallways of the emergency room. And it's an efficient waste that has and will continue to kill people. They say an ounce of prevention is worth a pound of cure, as it is easier to stop something from happening than it is to repair after the fact. It is easier and more affordable to care for everyone where they are at with what they need. There's no repairing the absolute worst outcome. Senator Marty, there's no cure for the worst outcome. No funding can fix it. That ripples our families, our friends, and our fellow citizens of Minnesota that we took an oath to protect and uplift. That's a failure. That's a failure in our duties. Senate File 2934 represents hope for many. Hope for those that rely on and need services and their caregivers and the family who love them. Hope for their family, that they and their family get the care they need. Hope that they will be able to live lives of dignity and right to care and support for the level of need that they have. And hope that they do not need to fear the worst for those they love when they are not there. Hope. That's when they need care. It will be there and they can live among their community. Hope that those who carry out this important work will be respected with financial security for the vital work that they do. It is the largest investment that we've made historically in this sector, even as we struggle with historic issues built upon decades of underfunding and massive change in the environment due to the COVID and workforce change. That said, Senator Marty, we were not given a target that fixes this system. I had hoped to get as many rates as possible to $20 an hour while supporting the structures and services as a whole that would have brought this continuum of care from underfunded to stabilized. You know the numbers, I gave them to you. That's a real number. This bill, Senator Marty, does not get us there. There are many strong financial provisions in this bill, and you know what? I'm proud of the work that the Human Services Committee as a whole did. We left our egos, like Jim Ramstad would say, leave those egos in the hallway and get the work done that needs to be at hand, and we did that. There simply wasn't enough to bring the system to where it belongs, Senator. And as you know, and we all know, it takes time to implement provisions in this omnibus bill. But by not investing enough now, we will see eventual improvements in the system, but those aren't starting till January of 2024, right? And then there's gonna follow up a year or two to see what actual shifts are happening. Then we will see that we still have those gaps, Senator Marty, that you and I have talked about and that we know are here, which will likely be any lower rate than the ones that we helped most. I made the statement about the silver tsunami and the long-term crisis, and that's important here. So you know what, Senator Marty, there's going to be hospital backups. There's going to be families that dramatically change their lives to fill a gap that we failed to cover. We will say our apologies. We're going to say we're working on it. We're going to evaluate it as we go. We're going to start a blue ribbon task force. We're going to have all that perhaps still. But you know what? Our oath still remains, right? I don't want it to remain unfulfilled. There's going to be those who see this pass. They're going to see this pass with hope in their hearts and yet will not benefit from it even if they qualify, leaving them with nothing but hope, Senator Marty. With that in mind, the provision I had that captured the Medicaid funds, it's real. The 1.825, I see it. I believe it's underspent. I'm not going to get in the weeds with anybody on that, but I just know this. There are people that are hurting out there. I consider this to be invaluable, and if we can't fix this issue this year, it gives us a place to start, Senator Marty, that we can continue on in promise of care, dignity, and security that is no longer just hope, until hope is no longer necessary because it's transformed and fully realized into just a simple reality. A system that cares for those in need, no matter where, who they are, because, you know what, they deserve it. This bill and every provision in it are solutions that we have worked on over many months, Senator Marty. This is our solution. The Senate position is a strong solution with what we've been given to uplift the system and now into the future so that anyone and everyone that receives the care they need deserve it. And after all, Senator Marty, this is our charge, and we fulfilled that charge. I just wish it was more. So I thank you for the conversations today. I thank you for letting me have my time in front of you and the work of our committee, which was a nonpartisan committee. Thank you, Mr. Chair and members of the committee, and I stand for any questions.
And thank you, Senator Hoffman, and your committee for that big work that making a lot of changes. And as you point out, there's need for a lot more, and it's urgent need. And I think when you talk about 2,000 people a day stuck in hospitals waiting for care because there aren't facilities to take them, it suggests how far behind we are. But.
And you know, Senator Marty, it didn't matter who you are. I was at Mercy Hospital, and a dear friend of mine who had heart surgery, and then he had after effects. They didn't have a bed for him. They put him in the emergency wing and had him in an emergency room where they monitored and kept him there until a bed was available, right? And then that's just the reality. And with that hospital, Senator Marty, 100 people are waiting to be placed. There's a woman at that hospital, third floor of Mercy Hospital. She's been there for 12 months. You know, the system is broken. It's going to get brokener, if that's a word I can use, but it's not there. We're getting weekly updates from HCMC, Hospital Association. The numbers you have are in front of you. So, Senator Marty, if we don't take care of our early waiver services, our alternative care folks, our caddy folks, all those buckets of supports and the caregivers, then what you have is what you see in front of us. And it goes back to my quote about long-term care crisis that's in front of us. So thank you for your time.
Thank you. There are other further discussion from members of the committee? If not, Senator Champion moves that Senate File 2934 as amended be recommended to pass. Members online, please turn on your videos and Senator Dames, your phone.
And that's my motion, Mr. Chair.
Thank you, Senator Champion. If there's no further discussion, all those in favor say aye.
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 Opposed? Motion prevails.
No.
No, motion still prevails. With that, Senator Hoffman, you know this is only a first step and a big first step in a lot of ways, and I hope we are, when you showed the numbers of how much it would take to bring all the direct caregivers up to $20 an hour, so they're not being taken away by fast food and type of things for far less important work. I hope we're making a step forward, though, as you know, it's not where we need to be yet. So.
Thank you, Senator Marty. And it was the Department of Human Services when Elise Bailey and Matt Burdick and Christy Grom and the other folks, and too many to mention, I'll make sure I mention them on the Senate floor. When Elise put that one pager together, it had an impact, a very visual impact. And you're right. You know, if you would have adopted my my forecast fix, you know, it would be a different.
And with that, Mr. Raymond and Mr. Monahan and Mr. Parker and all your committee staff and everyone, thanks for your work on this.
Mr. Chair, any announcements before the rest of us leave?
We are meeting it Monday. We are going to be taking up at 9:30. Senator Westrom wanted us to wait a little bit later, and so 9:30, we're going to be meeting, we're going to be taking up Health and Human Services and then Transportation, and those are both big bills, so I hope we can move through them. Spreadsheets there may be even longer than this one, but thank you all for this. With that, session is at noon on session, yeah. With that, this committee is adjourned.